Hey there, this is Luis Moreno with Simply Health Insurance Agency. Guys, there are some bad agents out there and they're doing some things that are not good for you all. So I'm going to share what's happening. If it happened to you, I'm going to give you a solution as to what you can do. But before I do that, guys, do me a favor. If you're one of my subscribers, thank you. But if you're not, please do me a favor, like the video, comment if you would like, and also please subscribe and share me to other people who need help with health insurance. I would truly appreciate that. All right, so let me share with you what's happening. Now, this is only happening to there's only a few agents that are doing this. Not all agents are like this. There are a bunch of us that do the right thing and really want to help you with your health insurance. Okay, we make a good living doing that, and we truly want to do a great job for you. But there are always crooks, criminals, rats that manipulate the system, and this is what they're doing, and this is what you can do if this happened to you. So here is an article, and this article is what rogue agents and brokers do when they switch your ACA, your health insurance plan. So first of all, the reason they do this, and you're probably wondering, well, why would they want to do that? Number one, when we enroll you into a plan, we get paid. We earn a commission, okay? So if I'm an agent, I visit with you, what I'm going to do is I'm going to ask you for your information, maybe your spouse, your kids, if you have any, and I'm going to ask you about your income. I'm going to ask you about your doctors and your medications and what you're looking for in a health plan. And then I'm going to do my job and try to find you a plan that best meets your needs and your budget. Okay, and then we're going to enroll and we're going to be happy. And then I'm going to earn a commission every single month from that insurance company that I enroll you in. Now, so you know, if you decide to do this yourself, it is the same price. It doesn't cost you any more money to utilize an agent. All right. So I've got you set up in a plan. You're happy. I'm happy. And everything is good. Now, some of these agents, these rogue agents, these rats, these criminals, if they get your data, okay, now remember, you have got to give it to them. And how do you give it to them? Well, you are on social media, maybe Facebook, maybe you're on Instagram, and you see this little ad that says, hey, click here to get your $500 free Visa gift card. You're like, oh, let me click on that. And you click on it and you give them your name and your date of birth and your state. That's all they need, guys. Or there's another ad circulating out there that says, hey, we will give you $6,400 when you get your health insurance to utilize for your rent, your bills, your gas, your utilities. And you click on that thinking that you're going to get it. And no, they're just trying to capture your data. It's called clickbait. It's fraud. And you're thinking, why would they let them do that? I don't know why Facebook and Instagram let them do that, but they do. They're out there. I see the ads all the time. You definitely do not want to click on those ads, because I will tell you, there is no free $500 Visa gift card. Okay. I tell some clients, come on, get real. You really think an insurance company is going to give you money? Okay. That's not their business model. Okay. They're not going to do it. But a lot of insureds fall for it. Okay. $6,400. Well, that's even, come on, get more real, I guess. But it's just not going to happen. Okay. But if you happen to click on that and you give them your information, then what some of these rogue rat agents will do is they'll go into the quote engine, the healthcare.gov, and they will search you based on your name, your date of birth, and your state. That's all that they need. And they pull you up, and then what they can do whatever the heck they want. They can open up your application. They can grab all the data that I entered that you trusted me with. Now they can get it. So they have access to everything that you have given me. Okay. They can, and they will do two things. They'll switch you to a different plan. They'll switch you to a different insurance company. They're going to do whatever the hell they want so that now they can get paid. Now, trust me, they do not care what happens to you when they move you to a different plan. They don't care that your medications may not be covered now. They don't care that the doctors that you're seeing may not take that plan they moved you to. They also may not care that the plan that it puts you on may have a very low out of pocket. That's your worst case scenario. And they move you to a different plan that has a much higher out of pocket. These damn agents don't care. Okay. So that happens. I've even seen them do crazier things. They change your address so that you don't get any notice. They change your email, your phone number so that you're unable to get any notifications that this has happened. All right. I mean, these guys are very, very crooked. So they do that. Now they get commissions. You know, they stole you from me. So I lost money. So I'm not happy. But then worst case is they took you away from the plan that I put you on that was very, very good, or that agent put you on. All right. So not a good thing. I've also seen them change income. And that's what this article is about. They will change your income so that you get more subsidies or assistance and you get a much lower premium. And you're like, well, what's wrong with that? The problem is when you file your taxes and that because that income was lower than what's going to be reported on your tax return, you're going to have to pay that back. So let's read this article, okay, and see what's happening. All right, so we're in April, tax season. We're April the 18th. Tax season just passed or just closed. And look at what's happening. So we already know tax season is not fun. But now what's happening is if this has happened to you, and maybe they even insured you, you didn't even know that they insured you. Okay, sometimes you give them that information and they'll just enroll you in the plan. They'll give you a fake spouse. They may even add fake kids to your account so that they get paid on each kid. All right. And so when this happens and you file a tax return, it's going to get rejected because you need to submit a 1095. This is a form that is generated by healthcare.gov that states how much assistance you got every single month. And you're like, oh, this is not a good thing. Of course, it's not a good thing. So now your return gets rejected because you're not submitting that form. You go and you get that form and you're like, what? I never had insurance. I never signed up. And it creates a very big problem. So unauthorized enrollments are creating tax headaches. Returns are being rejected by the IRS, and some people will have to pay more in taxes. It's gotten worse this year. I mean, it's really, really bad. Okay. They're trying to come up with a solution. There's not a solution yet, but I'm going to put a link to this article right here, this FAQ that the IRS posted, and it's right here. Okay. How to correct an electronically filed return rejected for a missing 8962. The 8962 is what you attach that 1095 to. It gets that data and you fill it out there. Okay. The 8962, the premium tax credit. Okay. That is what can you do if it's rejected? Okay. So there's some great questions and answers here. So why was my return rejected? How do I know if I was enrolled in the marketplace plan? What if I was enrolled but did not receive it? So it happens all the time. My insureds call me and I can immediately download it and email it to them. What if it's incorrect? Okay. What if they changed your income or they added kids or they just completely screwed it all up for you? What can you do? You're going to have to contact the marketplace to fix that, is what they're telling you. And then let's go back to the article. So how does this sign-up scheme work? Unauthorized signups can happen in several ways. Okay. Some agents troll online enrollment portals that are accessible only to brokers, but are integrated into the healthcare website. When those agents open up a new policy or switch a policy, they get a monthly commission. Again, why do they do it? Well, they're doing it to steal my commissions that I earned. Okay. Now, other consumers, and this happens a lot, unwittingly sign up when they respond to advertisements touting gift cards. There's that $500 free gift card, or government subsidies. That's the $6,400, and then are transferred to agents who enroll them in coverage. A lot of times they don't even transfer you. They just get your data because you enter it because you want to get more information, and they just do an enrollment. It's happening even after these new rules were put in place about us agents having to get consent to enroll you and in confirmation on all the data. CMS has not released details on how many consumers this has happened to, but it's got to be quite a few. All right, many people are finding out when they go e-file their taxes and it bounces back saying that the IRS cannot accept the return. Okay, here is another example. I mean, these agents are just horrible. Okay, so Ashley here enrolled with her employer. So wherever she works, she was offered health insurance and she enrolled. Okay, but now she's facing a tax bill for a plan that she never signed up for. Okay, unbeknownst to her, a broker in Florida enrolled her family in an ACA plan in February, even though her coverage started January through her job. The broker listed her income. They qualified the household for a full subsidy, which means he made up a number just to get her the maximum subsidy to get a premium of $0. So she never received a bill. Okay. Her first inkling that something was wrong was when she received a 1095 in the mail from healthcare.gov. After reporting the problem to the marketplace, she sought to get the 1095 voided so that she would not be liable for the plan's premium subsidies paid by the government to the insurance company that she was enrolled with. In the meantime, she has to file an extension. All right, but look at this. But because this Ashley's pharmacy had billed the ACA plan instead of her job, her request was denied. So it happened that while somehow in this scenario, she got the denial of her ACA plan because her pharmacy billed her insurance company, the wrong insurance company. So here's what happens. Instead of her getting this $4,100 refund, she now owes $700. That's $4,800 swing. Okay. So if this has happened to you guys, here's what you need to do. Okay. You need to call the marketplace. All right. First, because it could take weeks to get corrected forms, you first need to file an extension. Okay. When consumers file for that, if you owe any taxes, pay those. Okay. In general, consumers who at any point in the year think they are victims of an unauthorized enrollment or plan switch should report it immediately to either the federal marketplace or the state ACA place, depending on where you live. Okay. The marketplace, if you just go to healthcare.gov, you can get their phone number. When you call them, you can tell them your scenario, and hopefully they can backdate and cancel that policy so that all those subsidies that were paid to the insurance company don't affect you. So, guys, I wish I had a better solution. That's all you can do. Number one, I would recommend do not click on those ads. You need to be wise, okay? Don't be foolish. Do not think that somebody's going to give you a free $500 Visa gift card. Do not think that you're going to get a government subsidy given to you in the amount of $6,400 to help pay your rent, to help pay your utilities and whatever. It's just not going to happen, guys. Okay. I even saw an ad that had a picture of a check. So these agents made a fake picture of a check and said $6,400 made out to whomever. And it said, look, it's real. I got my check. Click down here to get more information on how you can get your check. And there you go. You're given their information and you're screwed. So don't fall victim, guys. A lot of this is your fault. Yes, I 100% blame these criminals, these rats for doing this. But ultimately, if you don't fill out that information, they can't get it. So don't fill out the information. So I hope that helps you out, guys. We're an agency here in San Antonio, Texas. We work nationwide with Insureds. If you have any questions, down below, there's a link that you can click on. You can send me an email. I can try to help you as much as I can. And if you need help from a reputable agent, I've been in business for more than 25 years. It's a family-owned insurance agency. My wife works here. My sister works here. Her husband works here. My kids work here in the summer. We are a true insurance agency here in San Antonio, but we've worked nationwide in most states. So if you would like help from us, just click on that link below, schedule an appointment. Me or one of my agents will call you and we'll see what we can do. Guys, thank you so much. And I hope you guys don't fall victim to what's happening to a lot of insurers. Thanks again.